calls are mounting for India to impose a nationwide lockdown to slow the spread of COVID-19 as new cases and deaths continue to soar. Now let's get the very latest. We're joined by our correspondent in India, Ishan Garg. A very good morning to you from South Africa, Ishan. Just a sense of the latest numbers. The last we had was that 4,000, a record-breaking 4,000 people had passed on due to COVID-19. Are those numbers correct?
Well, today India has recorded just under 366,000 cases of COVID-19. It's marginally lower than its record high of more than 400,000 cases of COVID-19. And several experts are saying that these are not the real numbers. These are just the official numbers, and they are barely the tip of the iceberg. The real numbers in the country could be way higher than this, and the reason for that is the testing infrastructure, the medical infrastructure in smaller towns and villages is actually negligible in some areas and very bad in others. And because of that, several people who've got symptoms of COVID-19, they're not being able to diagnose properly. And all of this is leading to these massive calls of a nationwide lockdown, as you pointed out earlier. But Prime Minister Narendra Modi and his government have not succumbed to those calls so far. They have resisted the idea, saying that the economic fallout from it could be actually massive. And because of that, they are asking now the state governments to impose local restrictions, and they're hoping that these local restrictions will help spread the virus, will help spread, contain the spread of the virus rather.
Ishan, politically, do you think Prime Minister Narendra Modi will bow to pressure and impose a nationwide shutdown?
Absolutely. So opposition parties are calling for a nationwide lockdown, but the government says that it does not want to go down that road, because when it imposed a nationwide lockdown last year, the result of it was actually catastrophic. More than 100 million people lost their jobs, and India saw a massive exodus of migrant workers from urban centers to rural areas. And not only that, this was the biggest migrant exodus since India's partition in 1947. And the government is worried that if it does impose a nationwide lockdown, the situation might be similar to that of last year. And at the same time, India is already struggling with funding for healthcare infrastructure and funding for importing more vaccines. And imposing a lockdown would only add burden on the government's coffers. And because of that, the government is not willing to impose a nationwide lockdown. But having said that, in almost 2/3 of the country, there are local restrictions in place. And experts are saying that that is also helping contain the virus a little bit.
Talk to us about the international aid that India is receiving.
Well, so far, more than 40 countries have contributed to the aid towards India, and these include countries like the United Kingdom and the United States, which are the biggest contributors, but also neighbors of India such as Singapore and Taiwan. And there are hundreds of, if not thousands of ventilators and medical equipment pouring in from different countries. But here, for the authorities, the challenge is actually going to be the proper allocation of these resources to different states. Now, the federal government says that it has set up a quota-like system under which it is going to divide up the resources based on which state is actually badly hurt. But there are public health experts who are saying that because of the bureaucracy and the red tape, a lot of that aid has not actually reached people. And in some hospitals, only in New Delhi, 7 hospitals until last week had received these aids from the Indian government. So the aid that is pouring in is certainly going to be helpful, but the division of it based on how much needs to go to which state is proving to be a bureaucratic nightmare so far.
You were talking earlier about India's health infrastructure prior to COVID-19. Was there much emphasis placed on sprucing it up just in case? Well, historically, the funding into healthcare infrastructure in India has been rather poor.
India only spends about a fraction, just 0.5% of its gross domestic product on healthcare infrastructure. A much larger spending is actually focused towards defense. And this is why experts are now saying that the negligence that has been imposed on India's healthcare infrastructure in the past 70 years, it cannot be overdone. It cannot be undone by setting up some field hospitals and importing medical oxygen and drugs in the past few weeks. That has happened. So there have been, government policies directed towards boosting healthcare infrastructure, but that has largely remained towards setting up bigger trauma center-like and bigger hospitals and only urban centers. Not as much focus has been diverted towards beefing the healthcare infrastructure in rural areas or in poorer neighborhoods, and that's the areas which are suffering the most because of COVID-19 at the moment.
Ishan, who is responsible for this disaster that's unfolding in India? Who are the people blaming? Who should be held accountable?
Well, there are people blaming a manner of people. So, for example, there is a section within the Indian society which is blaming the Indian Prime Minister Narendra Modi for holding massive rallies and allowing mass gatherings to take place, clearly saying that when India's caseload was low, India should have not exported a lot of vaccine and should have vaccinated people at home. There's also a section of the people who are now blaming the bureaucracy for imposing a lot of red tape in getting people tested or dividing up the resources, the healthcare resources, to real people. There are also people who are putting the blame on the previous ruling parties that have ruled India in the past 70 years, saying that because they did not put in money into the healthcare infrastructure, it's because that's why India is facing the situation it is facing right now. But health experts are saying that the new doubly mutant variant of the virus, the B1617, that was first discovered in India, is at least partially responsible for this massive spread that's taking place. And at the same time, the government is responsible for opening up the economy far too quickly and not imposing a nationwide lockdown now when it's absolutely needed.
So India is one of the world's largest, if not the largest, vaccine manufacturer. How has the second wave affected India's supply chain and global distribution?
Well, global distribution is going to be impacted severely because of the vaccine shortage in India. The problem is that the world's largest vaccine manufacturer, the Serum Institute of India, is not only supplying the Oxford AstraZeneca dose to India, but it's also supplying vaccines to international alliances like COVAX. And because of this rising caseload here in India, its domestic requirements are now much higher than they were projected a few months ago. So what's going to happen is that it's going to have to divert a lot of resources towards fulfilling the domestic requirement, and for a while at least, its international commitments may suffer. Now, there are several nations, especially in Central Africa as well, which are going to receive vaccine from the COVAX alliance, and there are others which are going to receive vaccine from Gavi and other international alliances. And because Indian vaccine manufacturers have now to focus domestically, they will not be able to meet their requirements on international fronts for a bit. But having said that, the government has put in more than $500 million in boosting the manufacturing of these vaccines within the country, and at the same time is also looking, along with South Africa, to get a waiver on the patent rights of vaccines. And once that is done, if the World Trade Organization agrees to it, the US has already supported the idea. It might be that several vaccines may get their patent waived off, and they might even be produced by pharmaceutical companies, of which there are a number of them available in India, and hopefully that will help boost the global vaccine production by a huge margin.
Thank you so much for bringing us up to speed.